And thank you for joining us. I'm Monique Minglavin from the Cairo 7 studios.
And I'm Steve Rabel. Thanks so much for joining us tonight. I'm reporting from home. Let's get you the very latest numbers now, and they show that there are now more than 20,700 cases here in Washington of COVID-19 from the start of the pandemic. 1,106 people have died. In total, the state's tested about 343,000 people, with 6.1% of those testing positive. Health officials tell us that they have more capacity for testing, and they want that positivity rate to go down to 2%.
And there is also alarming new analysis of who is getting coronavirus in our state. Earlier this month, half of the new cases were adults under 40 and children. Cairo 7's Allison Grande talked to the UW researcher who found the reason the number of cases in our state hit a plateau and is not going down.
We looked to see what was happening that might explain the plateau.
Dr. Judith Malmgren is an epidemiologist affiliated with the University of Washington.
The message has been that it doesn't affect children, and that if it does, it's a very mild disease presentation. And then also in the 20 to 39, same thing. Mild, not really that big of a problem. I don't think that is true.
She analyzed the positive cases of COVID-19 in the state in the last 2 months.
So I think that's kind of the big message here is in 8 weeks' time, which is not very long, we flipped age distribution from old to young, predominantly young.
As coronavirus spread through Life Care Center of Kirkland and other nursing homes, health departments issued strong warnings to anyone over 60 or with health concerns to stay home. It worked. The cases for those over 60 declined. Dr. Malmgren's analysis shows it's an increase in sick patients under 40 making up the difference and responsible for coronavirus cases hitting a plateau in our state.
That's concerning. The increase is not just in the percentage, but also in the number of cases.
Department of Health data since Dr. Malgren's analysis shows the week of May 10th, half of the new coronavirus cases were under 40. These are symptomatic patients who were tested with at-home kits, drive-through testing sites, or hospitals. And the concern is those under 40 are no longer being as careful. The same goes for children.
Parents are letting their kids play. I don't know how safe that is.
Dr. Malmgren's analysis is being considered in the state's reopening plan.
This is such a fast-moving target that modeling really helped us get to the plateau, but going forward, we need to get up to a more granular level of analysis so we can see, so we don't miss something like this.
She says the increase in cases for children really needs to be looked at as they make decisions for going back to school. The way the data is collected, she says it's hard to tell if children are getting sick from their parents or from each other. Allison Grande, Cairo 7 News.